Hi, I'm Jim. I'm from Lake Mills, Wisconsin. I'm 57 years old, and I had a back procedure done on the 5th of May at the clinic here, and it turned out very good for me. About 30 years ago, I injured my back, and over the last 30 years, I probably injured it 18 times, maybe 17 to 18 times, and I've had different types of treatment, from chiropractic treatment, which generally did pretty good for me for a while, but as I had bulging discs, eventually from heavy lifting and stuff that I did on my job, and so over the 30-year span or thereabouts, I had many different types of treatments. Other than chiropractic, I've had physical therapy. In the last few years, I've had steroidal shots in my back to relieve pain. There were times, probably 7 or 8 times in that 30 years, where I couldn't walk at all. Literally had to crawl on my hands and knees to go to the bathroom for sometimes as long as 2 or 3 days before I found any relief by going through some sort of treatment. I was scheduled to have back surgery on December in 2008, and I was on the internet, and I was just kind of Googling on things, and I found the Dayton Laser Institute, which is now a North American Institute, and it looked like that was a much better procedure than typical back surgery, traditional back surgery with fusions. I've had a fusion before, but it was in the cervix area, the neck, C5-6 area, and that turned out well for me. But back surgery is totally different in the fact that there's, well, one thing, there's no weight bearing on your neck, so it's a lot easier type of surgery. But the back was continuously sore, and there'd be days when it'd be a 7 or an 8 on a scale of 1 to 10, and there'd be days that I'd have a 1 or 2. When I came down here this last time, I was fortunate enough to not have a tremendous amount of pain. I was at about a 2 level, and after the surgery, immediately after the surgery, I lessened the pain. There's still a little bit of stiffness and soreness, but that's bound to happen right after a surgery, and this is only 1 day after. Immediately after the surgery, about 2 hours after everything was over, I was released to go back to my hotel with my wife, and we went shopping and did a lot of walking. I walked probably 4, maybe 5 miles yesterday afternoon after the surgery was over, and I'd been talking to some people, and one guy at a restaurant, I was talking to him, and he says, "You had back surgery at 12 o'clock?" And this is like 4:30 in the afternoon. I said, "Yeah." He says, "And you're up and out of the hospital and everything?" I said, "Yeah." I said, "They do a great job there." And so he was really impressed as well. And I'll tell anybody about this type of surgery. It's a procedure that's not brand new, but relatively new, and it seems to work very well in my situation. I also talked to several other patients that were here at the same time, built a little rapport with them, and they are also very satisfied with what their results. Some of them were in very much pain and couldn't hardly walk, and they're walking much better now. And I expect that I'll be able to play softball again this summer. I haven't done that for probably 15 years, and I don't know about bowling or not. That's a little tougher, but golf and softball definitely are some things that are my goal. I will go with physical therapy for a few weeks. I expect to be off of work for a week or 2 maybe, and my type of job, I'm a truck driver, but I was told here too that driving won't affect me too much. Lifting I have to be careful of, and that's to be expected with back surgery. But even when I had my neck surgery, I was off work at that time because that was a fusion. I was off of work that time for 8 weeks, and so that was even a lot longer and more invasive type surgery than what this is. The procedure here, they go through the bottom of the spine, through the natural opening, and go up there with a scope and a laser, and they treat the bulging discs or the degeneration or whatever you have, and shrink it down and relieve the pain pretty much immediately. And it's just a wonderful procedure that I can testify to, and it's a lot less expensive than traditional type surgery, a lot less invasive. You're not tearing any muscles that need to be torn, as a traditional surgery will go through the back, and in order to get into the canal area, they have to go through bone and disc and everything else, and so a lot more repair work has to be done. I have a sister and her brother-in-law that have both had traditional back surgeries, fusions, and multiple ones at that, 3 and 4, and they're both younger than I am, and they're both walking very difficultly. My sister is on total disability. She walks with a cane and is in pain constantly. The doctors have told her there's nothing more that they can do for her, and the same with my brother-in-law. And so their lifestyle is so much different than mine is, and I expect mine's going to be back to where it was 25 years ago, where I could do some things that like baseball or softball, and just playing games and stuff with grandchildren, and going fishing without having to worry about sitting in a boat seat for too long of a period, and perhaps even go deer hunting and drag that deer back out of the woods. And so I'm looking forward to this summer and this rest of my life. I know I'll have to do some exercises and be aware of the possibility of always injuring myself, but at the same point, if I'm wise, and which I will be, I'm sure that things will be great for me, and I'll have my life back. And I really appreciate the clinic here. The staff was absolutely marvelous here, very helpful, answering all my questions prior to surgery and after surgery. Explained everything very much in detail. Were very helpful in arranging for my stay here in Dayton, and also for prescribing things that need to be done, and just a great group of people here at the staff, and everybody involved. Dr. Rothstein is a very good doctor, very good bedside manner, and as well as the PACs. Doug was one of them, and I think Jenny was another one, and we just enjoyed our stay here, and are looking forward to great things and great happenings. And most of all, before any of this happened, I'm a Christian, and I really appreciate that God led me here, because I believe that this was a godsend, as I was supposed to have back surgery, and I just seemed it wasn't quite right, and I believe that the Lord led me to this place, and I think it's all His doings, and I thank Him for that. And so God bless you all, and I hope that you come down here if you need the surgery, and I'm sure it would be helpful to you. Thank you.